Are you someone who is suffering with frequent headaches? Then don't miss to watch this video till the end. First, it's time to check our cervical spine. What? Well, you will be wondering what is the relationship between the cervical spine and the headaches. So let me explain how. See, here when you look at the cervical spine from the side or lateral view, you will notice a lordotic curve and it's completely normal. And if you notice, there are two vertebral arteries traveling upwards to the transverse foramen which joins together to form the basilar artery to supply the brainstem. What we don't notice is there are vertebral venous plexus which surround this artery which removes the blood from the brain. So there is constant rhythms of blood going in and out. If any distortions in these vertebrae, it directly affects the hemodynamics of those arteries and veins. Eventually, these build up pressures in the brain by altered blood flow which causes migraines or cervicogenic headaches. If you notice, these arteries and vertebral alignment are engineered to be in a nice smooth curve. A study was done to check whether the hemodynamics of vertebral artery is related to cervical lordotic curve or not. And you know what? Their findings were very strong and the result shows there is a direct relationship between loss of cervical lordotic curve and decreased vertebral hemodynamics. That is, a loss of lordosis resulted in a reduced diameter of the arteries, reduced blood flow to the brain. And many other research studies also supports this. In addition to these skeletal changes in the cervical spine, the muscles and the soft tissues that support the neck have to work harder to compensate for the biomechanics instability. The bottom line is, maintaining the cervical spine curvature in 30 to 40 degrees is the safest option for the optimal blood flow to your brain, which in turn reduces the frequency of your headaches. If there was a drug for this, it would sell like chocolates. But sorry, no.